What you're going to be looking at today in this video is did a performance evaluation on a barrel horse. We ended up injecting her sacroiliac joint. Pretty common problem. She's getting quite sore there. She does have a bone spur in that joint on the right side. But in addition to that, for her right hock, actually has some pretty decent arthritis. It's starting to fuse. We treated that, the hock joint about 4 months ago or so, and she's still feeling pretty darn good on that, but she is getting more and more sore in her sacroiliac joint. So we treated that today. She should feel great. Hock soreness, SI soreness, I see those go together a lot. So it's not too uncommon that I'll see a horse, their hock sore, their low back sore. We decide to inject the hocks, kind of reevaluating a little bit, and then not too infrequently, maybe that back soreness has gotten better. Maybe there's not a primary back issue and it was secondary hock soreness, or maybe there's a primary back and a primary hock issue, like in this mare's case. So now we kind of hit both spots and she should be feeling great.
Alright, so today we are here at Epic. We are about to inject SIs. So why we're doing this in this horse? This horse was presented here for some soreness on the hind end, especially when the farrier was working. So that's a very indicative of low back soreness or some, discomfort over there. So we plan to do this treatment in order to make her feel better. So what Colton is doing, come here. Colton is doing right here is the cranial approach to this sacroiliac joint. So he's doing with the ultrasound to make sure he goes straight on the spot, and we're gonna do some steroids in this case, and hopefully it's gonna get better.
So the top part of the sacroiliac joint is more of a ligamentous joint versus a synovial joint or a joint with fluid, like say the stifle or the coffin joint. So when I do those ligamentous type joints, I don't use hyaluronic acid or the lubricant or kind of synovial fluid replacement products. Pretty much just go straight anti-inflammatories, take the pain and inflammation out of there, and that's where you get the best effect.
So now Dr. Benson is doing the caudal approach. We can go in the cranial approach or the caudal approach of the same joint. So the reason why we're doing this is to make sure all the structures involved in this junction between the sacrum and the iliac, that's the pelvis, are treated. So we're doing on the left side right now, and then we're gonna proceed to do the right side.
The caudal sacroiliac joint, caudal aspect of the right sacroiliac joint.
To give you further demonstration about what we have done in the horse, here we have the skeleton. So here, this is the pelvis, right? And here we have the ilium, and this bone here is the sacrum, right here. So what we just injected is the sacroiliac joint, which is inside here. It's basically, we are ultrasounding the area and making sure the needle goes all the way down in between this bone and this bone, which is the ilium and the sacrum. So we saw the cranial approach and we saw the caudal approach that goes right here. Understanding the anatomy is very important to perform this procedure because you have to make sure you're in the correct spot. So it is important to go in the right spot, because if you don't, you can damage other structures surrounding this area, which is not going to be beneficial for a horse, and you can have severe complications. So these injections are going to help her, or help these joints over time to relieve this pain and help her to get more propulsion from the hind end. So we're going to see in a few weeks how she's doing, and hopefully she's doing better.
Look, you don't even need time to wake up. You're just ready to go.
Cleaning the area so she doesn't go home too bloody.
So with that horse in particular, right, we've got hock arthritis. We have some sacroiliac arthritis. My recommendation for that, as far as kind of follow-up evaluations, is to get her checked up at least every 6 months. If she's feeling really good, if she's working really good. Obviously, if you're starting to feel something, performance drop off, soreness, asymmetry, etc., bring them in sooner than that. But I think 6 months for most performance horses in work is a pretty good number to go see your performance vet, get things checked out, catch little things before they become big things, get your horse worked on before it's lame, right? That's why we're calling it a performance evaluation, not a lameness exam. You know, hopefully most of these horses that we see are still sound.
So if you like videos like these, make sure you follow us in our YouTube channel and also in social media, because we are all the time updating and uploading new videos for you to know more about the horse.